Hello and welcome to the OFR Annual Report Lunch and Learn. I'm Ashley Romlow with the Health Department, and I'm grateful that you're all here with us to learn more about this great work and take a deep dive into the annual report. I'll be posting a link to an electronic copy of the annual report in the chat in just a moment. A few notes for housekeeping. Please remain muted. There will be a time for question and answer at the end, and we'll also be monitoring the chat for any questions and attempting to answer them in the moment, or I'll be popping them over to our presenters near the end of the presentation. This session is going to be recorded for later viewing by our partners and community members. Any follow-up questions can be sent to our OFR facilitator, Jennifer Skolasky, and I will be posting adding her email address into the chat in just a moment as well. Now I'm excited to be able to introduce Jennifer Skolasky, the facilitator of our overdose fatality review team and the glue that holds all of us together and keeps this work moving forward.
Hi, Zoom land. Maddie, can you see me okay? You have to do like the call outs to all family and friends. Hi, thank you all for coming today. So here's what our agenda looks like for the Zoom for the Lunch and Learn. We're going to give a little background on OFR and this annual report. Sarah-Jeanne Schlechterman is going to talk about data. She's our data guru. Then we're going to talk about some themes and bring Stephanie Gildenband up from the Health Department to talk about that and some priorities. Then we'll talk about all the great work that our team has done to make community change. And I'm really excited that we have three OFR partners today to talk about their success stories. And I know they're super excited to share their stories. So then we'll close and have time for question and answer. But as Ashley said, if you have questions at any time, feel free. So we've done this Lunch and Learn a couple times, and this is actually our 4th annual report. And it's something that we're really, really proud of. And I'm going to go to this picture because I think it's so cool. And I know some of the partners are probably rolling their eyes right now about them being on there. But, you know, OFR has become this platform for community change. It's this really incredible, committed group of people, 47 partners with representing 36 agencies, all trying to prevent overdose deaths. And every year we look at the great work that we've done and say, there's still urgency to do more work. We come together on a monthly basis to review cases of people who've lost their life to an overdose, but look at it in a different lens and look at it holistically and say, how did our community fail them and what can we change and what can we do better? But our team, as represented by all these pictures, and there are lots more, have really made an impact in our community in saving people's lives, but also thinking differently and changing not only the organizations that they represent, but also their personal lives. And so this is a big shout out to all the partners that are in the room going to be presenting today, all the partners in Zoom land, and all the people that'll watch this recorded for coffee or whatever it may be. So a huge shout out to them. I also wanted to show a list of all the agencies that are represented around the table. Every year we grow and we're grateful for the time that those partners spend really, like I said, diving into how our community can change. You know, this review, this annual report looks a little different as it has last year as well. So for the 2nd year in a row, we've seen an increase in people dying from overdose deaths. Sarah-Jeanne is going to really dive into the data for everyone that cares about that. And like I said, we'll talk about the stories of successes that we've had, because with all of the data, we create recommendations about what we can do in our community differently to prevent those overdoses from happening. I'm going to dive into those recommendations to show that, you know, we don't just meet on a monthly basis. We've got partners that are meeting almost daily, I think, on meetings, and I'm sure partners are once again rolling their eyes about how much they're doing, but it's such good, important work to show the changes that we're making. I'm really just excited that you all are here and that the community is doing this work because it's such important work. So thanks for being here, and we're going to dive into the data now. So Sarah-Jeanne.
Hi there, thank you for being here with us today. So my name is Sarah-Jeanne Schlechterman, and I'm the epidemiologist with the Winnebago County Health Department. So I'm going to go over some data related to the 2021 overdose deaths that occurred in Winnebago County. Last year, we had 41 overdose deaths, which is the highest number of overdose deaths that we have seen so far. This number represents intentional and unintentional overdoses, and includes all overdose deaths, not just opioid-related overdose deaths. In 2022, so far, we have seen 21 confirmed fatal overdoses and 11 probable fatal overdoses so far. Nationally, they are also seeing an increase in overdose deaths. So in 2021, there were over 107,000 overdose deaths throughout the United States. And that is 14,000 more than the year prior. The CDC has stated that there have been 3 waves in the opioid epidemic so far. That first wave started in the late 1990s with the rise in prescription opioid overdose deaths. We started to see the second wave in 2010 with the rise in heroin deaths. And then that third wave started in 2013 when we saw a rise in synthetic opioid overdose deaths, such as fentanyl. And this graph here shows that trend for Winnebago County data specifically. And the different colors on the graph represent those 3 different waves and the substances related to those waves. In 2021, fentanyl was listed as a primary cause of death in 28 overdose deaths in Winnebago County. Many of those deaths involve fentanyl as well as at least one additional substance, such as methamphetamines, cocaine, heroin. Across recent years, we've seen a decrease in heroin deaths, but we have been seeing an increase in deaths associated with methamphetamine and cocaine. And for the timing of deaths, we've seen overdose deaths happen throughout the year. There have been times where we've seen spikes of overdose deaths, which is when there are 3 or more overdose deaths in 1 week. And also in late 2021, we also saw a surge. So that was a continued cluster of spikes. When we see this happen, we tend to put a lot more information out for the public just so that they're aware. As for the 2021 deaths, the majority of those occurred in individuals aged 25 to 44. Although we see deaths happen throughout all age spans. And deaths continue to disproportionately affect people of color. Many of our overdose victims continue to die alone in their residence or residence of family members. When they die alone, it means that even if Narcan was available, no one was there to administer Narcan. And so that's why we're continuing to really push availability of Narcan and ensuring that people have access to that and that family members and friends know how to administer. As for the geographic location of deaths, many deaths continue to happen in the city of Oshkosh over other municipalities in our county. And that's because the city of Oshkosh does have a higher population. But when we start to look at the death rate, so death rate is the number of deaths divided by population times 100,000. You'll see that the city of Oshkosh and city of Neenah have very similar death rates for overdose deaths. And both of those municipalities are higher than the Winnebago County total and the Wisconsin total. In public health, we often use rates just because it's an easy way to compare across different size populations. One thing to note about this, city of Menasha and city of Appleton do fall within multiple counties. So the death counts for those 2 cities are specific to the portions of those cities that fall within Winnebago County. And I will now hand it over to Stephanie.
Hello, everyone. I am Stephanie Gildenband. I am a community health strategist here at Winnebago County Health Department, and I am very glad to be joining you all today. I'm going to talk through the themes and priorities that we have and that we've shared in our Overdose Fatality Reviews annual report. There are 4 themes and there are 4 priorities, and it just happens to be on page 4 of our annual report. So if you want to go back and reference these themes and priorities, they are outlined there. So our themes and priorities come out of the fatality reviews that we conduct almost on a monthly basis. And the themes themselves emerge through trends and gaps that we see across overdose fatalities throughout the entire person's life. So when we review overdose deaths, we look at the entirety of a person's life, identify factors that may have led to substance use and overdose, as well as interactions with systems and gaps in those interactions with systems where people could have been offered services or been connected to resources in our community, or maybe we didn't have those resources and services available. And that's some changes that we could see in our community to reduce the likelihood of overdose deaths in the future. So the themes that we identified over this past year of fatality reviews include childhood trauma, a mental health history, early onset of substance use, and community conditions. So childhood trauma is a factor that we had seen in many of the fatalities that we reviewed this past year, meaning there were several types of trauma that an individual experienced throughout their childhood. Oftentimes not being connected to the services and supports that they needed at the time that they experienced that trauma, which just exacerbated the trauma throughout their life. We also see a mental health history. So most fatality victims have some documented mental health history. Some were able to have treatment and connection to services, and some were not. But this is a major theme that we have seen over the course of several years now as well. The third theme is early onset of substance use. And we define early onset of substance use as people using substances prior to the age of 12, so 12 or younger. Usually alcohol and other substances is like the early onset. And one of the factors that we see with early onset is people who would tend to use substances early on tend to have more severe and more frequent substance use disorders as they grow into adulthood. So this was a theme that we saw across many of the fatality victims that we reviewed. And lastly, there's community conditions. And so this is where we're seeing people, especially not having the social connections in their lives. They are dying alone, where Narcan cannot be used, as Sarah Jean had mentioned before. I also want to highlight that we're still in COVID. So a lot of the community conditions that we saw beginning emerging in 2020, we still are in some of those conditions themselves. So what we do then when we look at these themes and we look at recommendations that come out of our fatality review is we have a recommendations and monitoring team that identifies priorities that we can move into in this next year. So given the themes and recommendations that we saw this past year, the 4 priorities include access to treatment, increased support for medical providers, improve response to changes in drug trends, and support children and prevent early substance use. So the access to treatment piece, this is honestly like the big elephant in the room, if you will. Many people are able to get access to treatment, but sometimes they are required to fail out of lower levels of treatment before they're able to get into the type of treatment that they need, meaning they may have to fail out of outpatient treatment when really they need inpatient treatment right away. So there's big challenges around accessing treatment, including barriers that are like long wait lists and not having social detox prior to being able to get into treatment, which could be a 2-week wait all the way up to 6 to 8 weeks. The next priority is increased support from medical providers. A touch point that we see is a lot of people have interactions with the medical system, and medical providers have shared that they don't always know how to best meet the needs of people with substance use disorders. And this can lead to challenges around stigma and not being sure how to connect and refer people to the help that they need. So a priority that we have is to help improve training for medical providers and improve referrals and also reduce risky prescriptions. So people that have a history of substance use disorder, maybe people that are in recovery, that there's better practices around prescriptions, especially related to opiates and other types of prescription drugs, that we have a less risky situation and also a place where people can have honest conversations with their providers to meet their recovery needs. The next priority is improve response to changes in drug trends. And this is a major issue that we've seen since 2020, especially. I think many of us have heard already that fentanyl is a cause of a lot of overdose fatalities over the last 2 years. And that's true. And it's also being mixed into other substances. So a lot of people are unaware of fentanyl's presence in drugs. We're also seeing an increase in meth use in our community. And some of the fatalities also include meth where fentanyl is not mixed in. So the reason that this is a priority that we really want to underscore is we want people to have access to things like Narcan and fentanyl test strips. And we also have to be aware that there's other substances that are causing overdose fatalities in our community. And we need to identify ways to reduce harm around those substances as well. And lastly, we want to prioritize supporting children and preventing that early onset of substance use. So if we know that children are experiencing trauma, and we know that the likelihood of early substance use could be the case for children living in our community now, how do we reduce that? How do we prioritize support and crisis support around children experiencing trauma, and how do we get them the help that they need if they are using substances, and how do we prevent that substance use overall early on? So that is our themes and our priorities, and now you're going to hear a little bit about the recommendations that are coming up in this report.
Thank you, Stephanie. So as I said at the beginning, the purpose of overdose fatality reviews is to prevent overdose deaths. And the way that we do this is through data and looking at people's lives. But, as Stephanie had said, it's catching those themes from review to review, and then it's creating those priorities year after year, saying we're going to create recommendations around that. So every year we vote on recommendations as a team. We have a recommendations and monitoring team that wordsmiths, because you always need good people that know the right words to use. And then we bring that to the OFR team, and we have really good discussions on it and vote on what our recommendations should be. Then we implement them, and that recommendations and monitoring team continues to monitor and evaluate them. So this past year, we made these following recommendations. Some of them are local, some are regional, and some are statewide. The statewide recommendations go to the Wisconsin State Advisory Group. So people that are department heads that have some power in terms of policy and legislation to make some of that stuff happen. But I want to focus on these. Our first one was talking about the role of child protective services. We know that a lot of kids are exposed to trauma, whether it's from substance use or the environments that they're living in, and CPS can't work with every one of them. So figuring out what other support services exist in our community to help those kids reduce that trauma. The next one, Chris is going to be talking about from University of Wisconsin, Oshkosh, the training that they actually held. So we already fulfilled this recommendation, and it was an outstanding training that, like I said, Chris will touch upon. Our Handle with Care program was one of the successes that we talked about last year. It continues to be a success. We actually just had a training with all the social workers this week, but we're looking at how to expand that around Winnebago County. So working with police departments and school districts on programs that they already do, but figuring out how to expand that and really focus on that trauma sensitive support. We're working with the jails on creating a system for people that are going into the jails that might be using medication for opioid use disorder. So how can we continue that treatment and making sure that people get the support that they need while being incarcerated, as well as upon release. Time after time, we know that there's evidence in supporting recovery coaches and really using recovery coaches to connect people to the resources they need, as well as getting to recovery. So as an OFR team, we voted on prioritizing this, making sure that more of our programs include recovery coaches, because people with lived experience can move the needle a lot more than sometimes professionals. We talked about in our last annual report about deaths of despair. We continue to work with people in our community and professionals in our community that are working on deaths of despair, so deaths related to substance use or suicide. And we know that many friends and families are left behind and don't have the resources or support that they need. So we continue to look at what resources exist and leveraging roles that already exist and creating new roles to implement that. Like I said, Chris is going to talk about the statewide system or University of Wisconsin Oshkosh and making sure that there's access to Narcan. Like I said, Chris will touch upon that. And then Chuck will be talking about EMS and what we've done locally and what we want to see statewide. But I want to highlight this organizational structure. And last year I showed you, and it can be overwhelming, but I think that just shows how much we're doing. So the reviews are just a piece of what we're doing. Each one of the rectangles on the left are the priorities, as Stephanie has said, and we have priorities from past years of things that we're working on. But all those circles or all those ovals are recommendations. The ones in gray are ones that we're working on that aren't even recommendations, but that have come about because partners have championed what's going on in the community or see a need for us to do something. Some things that we're really excited about that are coming out in the next 6 months is the We Heart You app. So we've talked about referrals or resources that exist in our community for people that are struggling with substance use disorder or loved ones, family members and friends that might be looking for that resource. That's one that we're working on. We're excited about our We Heart Recovery PSA that will also be coming out, as well as our peer response team. We were able to get a CDC FAST grant, which we wrote about in our annual report. And we're really excited about people with lived experience connecting with people that are struggling right there, right then, to connect them to the resources that they need. Waiting for a non-fatal overdose is too late. So trying to figure out more upstream how we can connect with people. Trevor will talk about our We Heart You event. So as you saw, Sarah Jean and Ashley and I all wearing our We Heart You t-shirts. It was an amazing event. Like I said, Trevor will talk about it, but I think it just shows the broader impact that this OFR team has really had, that it's not just within the reviews, it's not just within those organizations, but it's the entire community coming together, realizing that this is important work and continuing to do work. So now I want to talk about the successes, because I think this is the part that people like the best, is hearing from the partners about the good work that they're doing. So first I want to introduce the acting chief of police at University of Wisconsin Oshkosh, Chris Tarman. He also sits on the Breakwater steering team. He's been with our team since the beginning. And I'm just really, really grateful for his energy. This is why I'm introducing you. I can give you the full introduction. I'm just really, really grateful for his passion, his energy, his leadership, his vision, and he's a doer. So we're so grateful for him to be on the OFR team and also share his success. So I'm going to stop sharing here so you can see your beautiful face. Yeah.
Hello, everyone. My name is Chris Tarman, as Jennifer said, and I'm in the acting police chief role at UW Oshkosh. And I think I have a little bit of a personal story that I probably won't share with you today, but that really drives what Jennifer's talking about. And I have an opportunity to kind of make an influence based on my position. So this is why I get to sit here and talk to you. So my job is to really share a success, and I have been a part of the OFR recommendation team for quite a while. And my former chief, who still works at UW Oshkosh, he and I really believe in the things that we're doing here. So we sometimes push things forward because it's the right thing to do. And I think that's a little bit about how this happened. So there was a recommendation to train our personnel on campus and really to train frontline employees. So police officers, community service officers, which are kind of my security officers, community advisors. Those are the local students who live in Resville, kind of help guide the other students who live in there. The building managers, and really anyone else who wanted to attend in our community. So we talked to some mothers who had lost their sons at a different campus, asked them to come in and present and share their story, and then ultimately had some great partnerships with Unity Recovery and Solutions and the OFR team, and brought in the Winnebago County Health Department. And we held a great training early in April. We're actually in a planning stage to do another one of those trainings. And in between today and April, I want to say it was like April 7th, it was a few months ago, we've done dozens of other trainings where we're just kind of getting people informed on things that are happening in our county. So it was very easy to pull that piece off. The other piece of this was to get Narcan in local places so that our students and the people who attend or visit UW Oshkosh have access to that resource. And so we installed Narcan boxes or naloxone boxes in partnership with the Voices of Recovery program in all of our residence halls at Reeve Union, which is kind of a common area where most of our students and employees will kind of go through there throughout the day. We also got them installed at the Culver Family Welcome Center, which is a conference center on campus. And there's a lot of folks who kind of flow through that area. And we're working on installing them at the 2 access campuses that we have at Titan Stadium, and then also in the lobby of where our health department is. So I think at the end of this whole project, we'll have probably somewhere around 15 to 17 different naloxone boxes that are on campus. And it probably took a little while to adjust the culture of what those were meant for. Even in my own staff, like they had to understand that when people go get Narcan out of there, that's great. We want them to do that. So really the box is pretty cool. It's got a little magnetic thing that when the door opens, it just lets us know that somebody opened the door, and then we get notified and our staff goes out there and put new Narcan in the box so that it's just available at all times. So in addition to that, we created a poster that provides awareness about what Narcan is for, recognition for what an opioid overdose looks like. And we actually at the training had a person who was involved with from the health department take Narcan. We've actually did Narcan into her nose at the training, and it just really kind of showed that you don't have to be having an overdose. It's not going to impact you. So this is how valuable this resource is to our community. So this really just kind of shows that at the recommendation and monitoring team, and as Jennifer talks, all the folks in this room talk, we're not just talking, like we're actually doing the things that need to be done. And that's really something that's kind of a great thing to be part of here in Winnebago County. So that's just a success here that we've had, and we'll continue to try to accomplish these recommendations as they come out. So thanks, Jennifer and the team.
Unfortunately, we don't have the round of applause little button that needs to happen. Thank you so much, Chris, and thank you for your leadership. So the next person that I'm going to bring up is Trevor Fenric, who's the Executive Director of Solutions Recovery. I just want to give a huge shout out to Trevor. He hasn't been here since the beginning of OFR, but came with a new perspective, and extremely grateful for his leadership and agreeing to do every recommendation that we put towards him. He's just really done an incredible job of bringing people in recovery to the table, leveraging his voice and the voice of others in solutions, and just really grateful that he's part of the team. And he's going to talk about the success of our We Heart You events.
Hello and good afternoon, everyone. My name is Trevor. I'm the Executive Director for Solutions Recovery here in Oshkosh, as Jennifer alluded to. I'm also a person in long-term recovery. And, I think we in Winnebago County are very fortunate to have the partnerships that we do across agencies. When I joined the OFR, gosh, I don't know, maybe it was a year and a half ago or something like that. I wondered what it was all about, and I wondered what came of the recommendations, and just being able to be a part of that, to get involved, has been a tremendous experience. And we've really been able to work really closely with the health department to bring the voice of recovery and the needs of the recovery community to light. Stephanie Gildenband brought some listening sessions to Solutions a couple summers ago, and from those listening sessions we were able to figure out what the recovery community wants and what they need from support of the broader community, and from that standpoint we were able to come up with a few action items, and it's been really cool to be able to work alongside the health department to make some of those a reality. One of those things being the We Heart You event, which was something that was spectacular and wonderful, and yet you had to be there. But there's also a really cool video, a recap video of what transpired there. So the recovery community was able to be a part of that event from the beginning. We were involved in the planning. We were involved in the implementation. We supplied volunteers, and we were able to bring the community together and just be, I think that's something as individuals in recovery, we're always looking to just be a part of. And sometimes in the past, or maybe in other communities, sometimes it's hard to get the recovery community to meet with the broader community in that sense, where there's no judgment, there's no stigma. But we were able to accomplish that very well at this event, and to be a large part of how this event, I guess, was implemented. So it was a very touching experience. It was amazing to be a part of some of the panels that were there. I was able to lead a panel on peer recovery services within our community. And I heard a lot of great things about the event. It was powerful. It was moving. It was life-changing for a lot of people that maybe didn't know how close recovery was to them. So I think we're just very fortunate as a community to be able to work together to do the things that we do, not only from an OFR standpoint, but as just working together in the community to work with those who are struggling with substance use disorder. I think the We Heart You event was just a beginning for how we want things to go. We Heart You is it's a movement. It's bringing people together, reducing that stigma, and we're really fortunate to be able to be a part of that and to have that in our community. So thank you for the health department and for We Heart You, and for OFR for making this stuff a reality and really bringing the recovery community, giving us a voice and allowing us to be a part of. So yeah, with that, I'll turn it back over to Jennifer.
Awesome. Thank you so much, Trevor. So our next person is Chuck Hobley from the Oshkosh Fire Department. And Chuck has been with us since the beginning on the OFR team. And he's my growth story about what OFR can do for a person, an agency, a community. And I'm so grateful for his leadership and how he's really impacted the culture of his organization, but also for his humor and his snarkiness, which makes us all laugh and makes us all so happy. So I'm going to turn it over to Chuck, and he can talk about the Leave Behind Narcan kits.
Good afternoon. I am honored at the opportunity to be able to speak at the lunch and learn today. I'll drink of water, so just the camera a little bit so you can see my 5 head, not just my 4 head. Just, a little bit of a personal experience leading into our approach when it comes to harm reduction. And I'll talk about that a little bit here in just a moment. I've been in emergency medical services for over 30 years. I'm the old man in the room. And I'd love the maturity that I have now that I'm older, but I think back to my early years in the profession and being involved in EMS, and the ideas that I had when it came to substance use issues, alcoholism, drug use, was very much focused on, hey, these are decisions that people were making to put these substances in their bodies, and they should probably have to deal with the consequences that they face for doing that. I remember my dad was a high school teacher, and I lived in a home where my mom was a stay-at-home mom, and the meals were put on the table, and laundry was done, and we had nice birthdays and nice Christmases and things like that. And my dad reminded me several times as I was growing up that other people didn't have the same kind of home life that we did. And I never really saw that. I heard his words, but I never really understood what he meant. And I felt that way when I first got into EMS, when I was an EMT in a volunteer service down here in the Madison area, and when I got to Oshkosh and worked as a paramedic, still kind of had that mentality of what these were bad decisions that were made by people, and maybe they should face the consequences of their actions. And then I got involved in, way back when, it was the heroin task force, and was involved in the harm reduction pillar. That's really when the light came on for me. And we looked at data, we looked at information, some of the things that Stephanie talked about the people that we're seeing who overdose, who die from overdoses. They have a history of childhood trauma. They have a history of mental health issues, early onset of substance use. And I even just shook my head here a few moments ago when she was talking and talked about people who are less than 12 years old when they start using substances. How can that happen? But it happens because that's the norm. These people see this happen in their homes as they're growing up. These young kids do, and they think that's norm, and they start. It's just what happens in their families. And then community conditions. And so all of those were light bulbs that were turned on for me. And I realized that a lot of the people that I took care of as a paramedic, that we see in society, didn't have the upbringing that I did, and their societal norms were a lot different than mine were. And for a lot of reasons, they get involved in substance use, and it's not a choice that they made. I don't think anybody chooses to become addicted to a substance. I don't think anybody chooses to overdose. Things that we've heard about fentanyl here in the last several months and years, even about thinking that they're going to use a substance that doesn't even include an opiate, and yet they die from an opiate overdose. They're not expecting to see these things. So that transitions really into harm reduction. Emergency medical services is very responsive. We're not really proactive. We're responsive. You call 911, you have a medical emergency, the ambulance responds, we treat life-threatening conditions, and we'll transfer you to the hospital. We're paired in Oshkosh with the fire department. That's who my employer is, the Oshkosh Fire Department. And when you look at it from a fire department side of things, we've almost fire prevented ourselves out of going to fires. We go to a fire a week, maybe, where we used to go to 10 fires a week 100 years ago. So all the things that have changed in building codes and fire codes, electric codes, safety ideas, smoke detectors, are all things that have really, again, almost prevented us out of service. We don't do that in emergency medical services. And that's one of the changes that we're trying to establish in Oshkosh. And so harm reduction, that we're not, our response, our 911 ambulance response to someone who may have overdosed is not going to solve their substance use issue. But you can show an analogy to that to somebody who might be having chest pain or having a heart attack. The ambulance responding, we're going to stabilize the situation. And there are a lot of things that need to change down the road, including lifestyle changes, diet changes, those kind of things. And patients have to decide whether or not they're going to do it and when it's appropriate for them. So when you look at someone who may be suffering the acute reactions of an overdose, that we can get there, we can take care of the situation, and maybe through the distribution of Narcan, that if they're not ready to take that next step towards recovery from a harm reduction standpoint, they aren't going to, if they experience an overdose in the future, that it's not going to be fatal. We know from our experiences that people who suffer from substance use disorders are very contributing, great members of society who make great contributions, and they need to sometimes just get over that hurdle so that they are able to do that. And from a harm reduction standpoint, where we offer them Narcan, where they might have the ability to administer it to someone in a situation that buys them time until the moment is ready for them, or the time is right for them to seek treatment. That's really what the Narcan, Leave Behind Narcan program is about, and the harm reduction part of it is about. We've embraced it as a department, and I'm super proud of that. And I looked in a mirror and thought, if I felt the way that I felt about substance uses and overdoses, that there are probably coworkers that I have that feel the same way. And so we don't want to put everyone in the same kind of basket, but we want to make sure that everybody's aware of what's going on in our communities and the people who are facing these challenges, kind of the issues that they're dealing with. And so it started with us presenting the results of the annual report of the Overdose Fatality Review. And I was really happy with how it opened the eyes of firefighters and paramedics in Oshkosh, and they understood it. And really the capstone of that was bringing in a peer of ours who had suffered from substance use disorder. And he told his story and explained how he got involved in public services and public safety. And our people had a lot of questions. And based on that, the information that we've received from the Overdose Fatality Review Committee and the annual report and the changes that we're working on, it's really been embraced by our department. So we started in February of 2022 with our Leave Behind Narcan program. We've left behind between 25 and 30 now, going back to that time period. We are ready to make the next step. I'm not sure that we're ready to announce it just yet, but the next step in the harm reduction in a way that we at the Oshkosh Fire Department can be a part of that. We're super excited. You know, you'll hear about it shortly, but it just is a great preventative kind of contribution, I think, that we're making to the community, and we're excited about that. So again, honored to be able to talk today and share some thoughts and kind of share my story with you, and really proud of the collaboration that we have with all the people around the group. So thank you. It's Friday. Have a great weekend.
I'm just here to bring back the PowerPoint. He is tall. Should be good to go, Jennifer.
Okay. Right. We'll go through a few of these. There we go. Thank you so much, Chuck, for sharing your personal story as well as the success that you've had, as well to Trevor and to Chris. I'm so grateful for all of you and your partnership and your commitment to this work. And you know, they represent a small subset of the amazing OFR team that we have, and that everyone is working hard. So where do we go from here? And we put these 4 points in the annual report, but I just wanted to dig in a little bit more. I think Chuck did an outstanding job of, you know, talking about harm reduction. And we just recently, you know, had overdoses in Grand Chute that were brought to the media attention, and our team was lucky enough to comment on it. But you know, the health department has done, the Winnebago County Health Department has done an outstanding job in this area. And we've talked about their success before and their support, but making sure that we have harm reduction items available to our community. So you are able to get Narcan and fentanyl test strips from the Winnebago County Health Department. You can get Narcan from the Oshkosh Fire Department if you were to have non-fatal overdose. And there are a few other locations, which we'll put a map in the chat as well, so you can do that. Chuck also mentioned this, and so did Stephanie, about you know, the risk of overdose from non-opiate drugs, which is a huge conversation for us. As Sarah Jean presented that information about methamphetamine and cocaine and alcohol, you know, rising to the top. You know, knowing that there are a lot of issues in our community, a lot of struggles, and so we have to know how to communicate, you know, the risk, but also the support that's out there. Improve that communication. So we have recommendations around those younger age groups and doing that outreach, and Breakwater has done an outstanding job with that, and they'll continue to do it. But you know, letting people know that who are younger, that overdoses are happening younger because of fentanyl being in substances. And so we want people to be safe. And then the last one is that establishing connections to treatment and recovery services while people are being released from incarceration. So we've talked about how that's a danger, a huge risk factor. And so we have some recommendations from the OFR team to work on that. But we'll continue to bring partners together to review those lives and think about the themes and recommendations on what we can do. So we want to end with, you know, a few ways that you can stay engaged and that you can help your loved ones. The Winnebago County Health Department is having a free virtual training on August 31st for International Overdose Day. So from 12 to 1, the link is right there. You can get trained on how to use Narcan, and then you will be able to get Narcan at the health department, as well as fentanyl test strips at the Oshkosh location. We're really promoting the Rethink Addiction Run because it's a great community event to support people in recovery, people that are in treatment centers. We actually have a We Heart You team. So if you are by yourself and you want to be engaged, you can join our team, and that way you won't be alone, because that's really what this is all about, is connecting people that that care about this, but also people that are struggling that we can care about you too. There are a lot of great recovery organizations in Winnebago County. We've listed 3 there: Solutions Recovery, Unity Recovery Services, and Adversity. They do amazing things. Please check out their websites so that you can figure out how to support them. We also have a We Heart You Facebook page that we created after the event. You can stay up to date with things that we're working on, news and other ways to be engaged. The last page that I just want to show, once again, we keep promoting 211 as that resource referral helpline, so that if you're struggling with addiction or even need access to basic needs, it's a great resource for you. Breakwater is doing outstanding work with reducing youth and adult substance use in that prevention realm. So find out how you can get engaged with them. We've talked about Narcan a lot. It's because that is one amazing tool that we have in our community to save people's lives. So take access of it, get trained on it. A big shout out, we've got the health department's website here, but I'm extremely grateful for the support that the health department has given to this OFR team. We've got 4 of them on that side over there that are helping with this lunch and learn, and just so grateful for their support, leadership, and everything that they do to make this work. If you have further questions or want to connect with the OFR team, you can always connect with me. My email is also in the chat. And then the last kind of plea that I have for everyone before we open it up to Q&A is check in with friends, family, and colleagues. Be intentional. Pause when you ask people, how are they? I think we get so in that realm of, how are you? Okay, great, I'll move on. Take the time to just show some compassion and support. And if someone is struggling, know that there are amazing resources in our community. Winnebago County is doing outstanding work. And we really hope that you will connect them to the resources that are there. So we're so grateful for the work that's been done, but we still have a lot of work to do. So thank you for joining us. And now I'm going to stop sharing and open it up to Q&A if there are any questions. Teresa, great question. So glad that you're here. First time call. No, I'm just kidding. Not like the radio. So we actually do not. We have a really close partnership with the Winnebago County Coroner. And the coroner's office does an outstanding job of connecting with families after they've lost a loved one. Our plan for the next year is to hopefully do next of kin interviews where we connect with families, not only for the purpose of supporting them and giving them resources, but also finding out more about their loved one. But that's in the process. That's not something that we currently do. So our hope, we wrote a really big grant, and our hope is that in the next year, we will be able to have a bereavement coordinator in the Winnebago County Coroner's Office. The purpose of that bereavement coordinator is to really connect with those traumatic deaths, those deaths of despair, to support loved ones, family and friends that are left behind. Currently, the coroner's office does that, and they don't necessarily have the capacity to do it, nor the training. So we're hoping that we'll be able to get funding to hire someone to be in that position so that they can support those loved ones, and they'll be the one that does those interviews. Okay, what's the next question? Cassandra, can you unmute? Are you still on?
Yeah.
Oh, there you are. Okay, yeah. Go ahead.
Hi. So I work for Partnership Community Health Center, and I am a school health liaison. So I basically connect our community center that has medical, behavioral health, and dental with the middle schools and high schools in Appleton so far. It's a newer position, so we're starting to make connections when we can. But one of the big things that I wanted to start when I first started, that we're actually going to be doing this coming school year with 2 schools to start to see how it goes, is mental health / life skills groups for teens. And I took a survey the end of last year from students, and drug use and alcohol use was one of the topics that they showed interest in. So I'm just wondering if there's any curriculum or websites or, anything that way to help, teach kids about kind of what you guys were talking about with that prevention part when it comes to drug use.
Thank you. I'm excited to hear all the work that you're doing. And I put our contact information in the chat, but I think connecting you with our Breakwater Coalition coordinator would be a really great step here. Our Breakwater Coalition really focuses on adolescent substance use prevention, which sounds very much aligned with what you are trying to accomplish at the schools that you're working in. So Hannah Wills is the coordinator for that. She is on vacation today, or else we'd probably be able to connect you with her right now. But if you want to reach out to her by email, I'm sure she would love to connect with you about that adolescent piece.
Okay, perfect.
Thank you.
Thank you.
All right, let's see if there are any other questions. Are there any other questions outside of the chat? Teresa, did you have another question? Do you message about not using the loan or that there's someone? Okay. Teresa, was your question answered or did you want to ask it?
Oh, no, Ashley answered it.
Okay.
Thanks.
Excellent. Okay, if there are no other questions, I think we're gonna end this lunch and learn. As we've said before, if you have any further questions, feel free to email me. My email address was in the chats. Also, when we promote this, I know that we'll promote it in the way that you can connect with me. So thank you all again for coming today and being part of this conversation. Hope to see you in the future.